Good day, viewers. Welcome to another interesting episode of Let's Talk with Joke. Today's topic is a very educative one, so I want you guys to sit down, relax, and pay attention. So this is the topic: HIV and STD pandemic in Nigeria. And we have our very own health practitioner.
Okay, thank you, Joke, for having me. My name is Gideon Tayila. I'm a health practitioner, also a social worker, and I'm also a health content creator. Yeah, so thank you for having me on your show today.
You're welcome, and thanks for coming.
Yeah.
So he is a health practitioner and health content creator. So if you go to his page, you see a lot of health talks and you get to learn a lot from him. Okay, so Mr. Gideon, in layman English, what is HIV and STD?
All right, so basically, HIV is a human immunodeficiency virus.
Okay.
Right? The virus that attacks and eats up your immune system, making your body vulnerable to a lot of infections. Yeah, and then STD is sexually transmitted disease. You can also call them infections as well. Yeah. So
it's possible for someone to have HIV and also have STDs?
Yes, it's very possible.
But is it also possible that you can have STDs and not have HIV?
Very possible that you can have STD and not have HIV at all.
Okay, so is it possible that in a relationship, or for example, now we have this couple, the husband is HIV positive and then the wife is HIV negative, and then they are still together in the marriage. Is there any possibility of the husband infecting the wife with this virus?
Yeah, there's a lot of possibilities. Yeah, I've seen situations where husband and wife married, the other one is infected, the other one is not infected. Okay. Yeah, if only they follow the medical measures, if you follow your health care provider, the instructions, then you both can live fine without one being able to contract the infection.
Okay, so yeah. What you mean by follow the healthcare instructions? By they always have to have sex using protective?
No, you don't have to have sex using condoms. Yeah, because obviously you produce babies. Mm-hmm. Yeah, because there are some people. You talked about HIV pandemic, and I wanted to talk more about it. It has. HIV pandemic in Nigeria at large has been significant, yeah, with high level of infection in the society. Yeah, so when you look at it very well, there are a lot of people that have been infected with HIV, but not living up to the expectation, maybe what doctor's instruction. Yeah. So in a situation where you have couples, maybe probably a wife being infected and having to infect the husband is because maybe they are not adhering to their medications. Yeah, if you are adhering to your medication and you turn out to become undetectable, it's possible that you will be married happily, you produce your babies without any of them contracting HIV.
Oh, okay. Yeah. So that means it's possible in a marriage where one partner is negative and the other partner is positive, if they pay close attention to the instructions given to them by the medical workers, they can live happily ever together without having to infect each other.
Exactly.
Okay, so let's talk about in general the cure, because now we know that one of the major avenue in which people contact these diseases is through sex.
Yeah.
Yes, because I don't think there's basically any of that. I think the largest number is through sex. Some people say if you share sharp objects and the likes of it, but I think it's just generally sex. It's not just about sharing. Even I can remember some time ago I was going to the salon to get my nails done, and then my uncle said, HIV, I can't remember the way he said it, and everybody in the room just started laughing like, coleto, you want to go and share scissors and that with people, and you have forgotten that there's HIV out there and all of that. So I think basically is through sex.
Yeah, there are 1,001 ways in which one could contract HIV. But I feel sex is just one of the common ways people contract HIV lately.
Okay.
Yeah, because you were talking about HIV pandemic, the rate of infection in the society, which I think sex education is underrated in Nigeria. Because if sex education was to be considered or maybe taken very, very important, all these things, contracting the infection through sexual intercourse will reduce. Because I bet you there are a lot of people that have contracted this infection through sexual intercourse and they are not even aware
of it. People
tend to live with HIV for 1, 2, 3, 4, 5 years without even them knowing that they actually have this infection. And when by the time they diagnose them of HIV positive, and you tend to ask questions to do your finding, you discover that a lot of them contracted it through sex.
Okay.
Yeah.
I think basically one of the things you said is sex education, creating awareness and the likes of it. And then I think people also look at the stigma, when they probably find out that they have HIV or they are positive in one way or the other, they tend to draw back, like, what would people say? They will laugh at me and all of that, And then some people just see having HIV as death sentence, and they've forgotten that HIV is like the baby, the ogata, which is AIDS itself. It's right there in the corner looking at you. If you don't, so what's the relationship? What's the timeline for a patient that's infected with HIV before it gets to a full-blown AIDS?
Okay, first of all, you talked about the stigma, people creating awareness and stuff like. See, gone are the days when HIV was like a death sentence.
Okay.
Right. Lately, there have been ways where there are medication that controls the infection. Yeah, from spreading all over your body system. You understand? So HIV now is not a death sentence, except you make it a death sentence. Okay. Yeah, by not taking your medication, adhering to your medication and stuffs like that. So like I said before, HIV has the ability of staying in your body system for as long as 5 years, 10 years, depending on how strong your immune system is. Yeah, before it you might start seeing symptoms and all of that. But if you are actually waiting for symptoms to start showing, it might be too late. Yeah.
By that time, will you have gotten to AIDS? Like,
yeah, sure. It might have gotten to AIDS. I know cases. I've had cases like that. They've been infected with HIV ignorantly.
Okay.
And our health system in Nigeria now, you will be infected with something, they will be treating you for a different thing. HIV comes with a lot of symptoms.
Okay.
So unless you are being tested, they wouldn't know. It comes with a lot of things. So there are some times when you go to the hospital, you are sick, you go to the hospitals and the doctors or the health providers are treating you of the symptoms and leaving the original thing. You understand? So before you know it, it has gotten to AIDS. Let me tell you a story. I know of a couple, right? She was infected with HIV. The husband actually infected her. This is all because of the stigma, the husband, being shy, that, what people will say. It infected the wife, and as time goes on, the wife became sick and stuff like that. They were busy. They took her to the hospital, actually, busy treating the symptoms of HIV. And it didn't dawn on them to run a test on her. So by the time they later ran the test, it has already gotten too late. Now she is in her grave.
Oh, but I think that every standard hospital out there, once a patient walks into your hospital and says, oh, I have this, I have that, I think I know of some hospitals, like if you are standard, the first thing, apart from running malaria and typhoid tests, they go as far as running HIV tests. They will tell you, initially when they take your blood sample and all that, they probably will not tell you. But at the end of the day, when the doctor calls you into his or her consultation room, the person will tell you, oh, you are this, you are that. And we also went as far as conducting so test, which is the HIV test. So I don't think that any standard hospital that knows what the rules or what the rules of engagement is should, when you see someone in that kind of critical situation, it's not just giving Panadol for stomachache. I believe they should also run the basic test. And in order to save life. So we'll go on a quick break, then we'll come back and talk about the cure, if there is actually a cure.
All right.
Okay, so let's go on a quick break. We'll be right back. Welcome back. So, Mr. Gideon, you were talking about the cure before we went on the break, and I remember when I was talking about hospital and checkup, you only said one or two things on that.
Yeah, you made mention of hospitals, having to check people anytime they come to the hospital, maybe testing them of HIV. But the question is, how many standard hospitals do we have in Nigeria? Yeah, so there are some hospitals that are actually quack. Some are after the money. So for them to run a HIV test to find out the causative, what is actually causing the symptoms, it will be difficult for them. You understand?
Is it that to run the test is expensive? Or
it's not expensive, but no, let's assume maybe someone comes into your hospital now complaining of headache, and maybe if you had run a HIV test and discovered that the person is, HIV positive, the money you were supposed to make from that patient, you will not make it again.
Why aren't you going to give the patient the necessary drugs or prescription or consultation that is required for the person to have a good life?
Of course, HIV treatment is very free and stuff like I'm speaking from experience actually. Yeah.
So if the person has HIV, is it possible that the person will have malaria, typhoid, and all of that also?
Yeah, like I said, HIV makes your body system vulnerable to infections. And the infection that is not supposed to disturb you for a long time, it will tend to disturb you because you don't have a very strong immune system to fight those infections.
Okay.
Yeah, so being HIV positive already made you vulnerable to
malaria, typhoid,
to other infections, and especially when you are not adhering to your medication.
Okay, why I asked that question is because you said that if the hospital will be deprived of the money they're supposed to make if they run HIV tests and they find out that the patient is positive, that they will be if the patient is positive of HIV and the person has malaria and typhoid, they will make their money from treating the malaria and typhoid, while they will refer you to the HIV centers where the treatment is free.
Yeah, right. You can only, I agree with that, but how many hospitals are ready to do that? You understand?
That's why I say standard. You need to know your onions. You need to know why this is healthcare. So they're not supposed to be selfish or hide that knowledge from any patient that has such sickness or diseases. Okay, so Mr. Gideon, let's talk about the prevention. And then before that, there's a question. Which is easier to contact? Is it through vagina or through anal sex? Because there's this question, like people say in the key areas and the key populated areas. When we talk about key populated areas, we talk about men-to-men sex workers, people that inject themselves in the prison yards, and those enclosed places. Those are the key populated areas, and research says that they have highly populated. You understand what I mean?
Yeah.
So which would you say can be easily transmitted? Is it through the vaginal sex or through the anal sex?
Okay, so whichever transmission, whichever way, it is easy to contract HIV. But the most easiest way to contract HIV is among people that have anal sex. Yeah, because the anal lining is very thin, very tender. So, and that space is usually not meant for something to go inside. It's meant for something to go. So once you are mounting pressure,
it's meant for something to come out.
Yeah, meant for something to come out. Sorry. So once you are mounting pressure against
something to come out, like poo.
Yeah, poo.
Say it's meant for poo to come out. Because you say something to come out, you say maybe it's what will go in that will come out. So something like poo to come out.
Exactly. So if you are mounting pressure against it, I mean, it is very easy for you to have a cut when you are having anal sex. So that makes people who have anal sex more vulnerable to HIV. I mean, have the highest risk of contracting HIV.
Yeah. Okay, than the
regular people that have vaginal sex and stuff like that. I'm not saying you cannot contract it via vaginal sex, but I'm just saying there is more risk when it comes to anal sex.
Okay, so let's talk about mother and child transmission.
Okay, I will not be talking deep about that, but let me just say it is possible a mother that is HIV positive could conceive, birth her child without HIV. Yeah, God has
without giving the child.
Yes, HIV. Okay. Except maybe the mother is not adhering to her medication during pregnancy.
Okay.
And there are some conditions that could make the child contract HIV. Yeah, maybe through vagina, when there is a vaginal tear and stuffs like that. If not, you can conceive, birth your child without any form of, transmission at all.
Okay, so if your mother has HIV and then gives birth through CS, is there any
that is when trained professionals come in.
Okay.
Yeah, if they are very professional, they are professional enough, nothing of such will happen.
Oh.
Yeah, if they are careful enough, nothing of such will happen.
Okay.
Yeah, basically it's when a child has a cut, and HIV does not need a pint of blood for you to be infected. A little cut could get you infected. Yeah.
Okay, so moving on, let's talk more about the prevention.
Okay, I would say there are lots of ways, or there are a lot of preventive measures when it comes to HIV. But we'll talk about including drugs and condoms and stuff like that. But before we talk about that, for me, I feel creating awareness is the overall preventive measures.
Okay.
Yeah, because I made mention of something. There is high rate of HIV infection in the society. Sometimes you tend to ask yourself, what is really happening? And amongst the people that are infected, young adults. When I say young adult, I mean from 16, 17 to 25 already living with HIV.
HIV. Wow.
Yeah, and a lot of them don't know what HIV is, and they don't know that exposing themselves to without condom could expose them to HIV infection. So tell me, even when you talk about the prevention, they wouldn't even take it serious because they don't know what it is. No one will prevent what they are ignorant of. Yeah, so I think the best preventive measures is creating awareness. Let's tell people what HIV is all about and the repercussion of, being infected with HIV. Now, we have medication that prevent you from contracting HIV. Yeah, medications such as PrEP, pre-exposure prophylaxis. And let me shock you, a lot of people who are sexually active don't actually know about this medication. Or maybe they do, but they don't know how it actually works. So sometimes when someone tested positive, they'll be like, oh, but I've been taking PrEP and stuff like. The question is, how have you been taking it? Have you been taking it very well? It is another thing to take PrEP and another thing to take PrEP and another thing to take it rightly. So PrEP is not an after sex pill, and it is not a medication that prepares you for sex, because I've learned that a lot of people only take PrEPs when they want to have sex. So it is not only not going to work for you, and if you continue like that, you will become resistant to it. When you seriously need it, it will not work again. Right.
Okay, so PrEP is a medication taken before sex to prevent HIV.
No, that's what I'm saying. It is not a medication taken to prevent what did you say again?
HIV, from contracting HIV?
Yeah, from contracting HIV. But what I'm saying is, okay, let's put it this way. PrEP needs at least 7 to 20 days of daily use for it to be very active in your body system. Okay,
so it's for the prevention of HIV.
Yes, it's for the
just like the way a lady would take Prostanol before sex to prevent getting pregnant.
It's far different from that. That's what I'm trying to avoid. It is not a medication that prepares you like Prostanol 2 or maybe an after sex pill. No, if you are actually taking it like that, you are abusing it, and it's definitely not going to work for you. Before you take PrEP with intentions of preventing yourself from contracting HIV, you have to take it consistently for 7 to 20 days before you have sex. You cannot start taking PrEP today and you go and have sex tomorrow. Definitely you contract.
So it has to be in your system for at least 2 weeks.
Exactly.
Before
it can become active in your body
before
system.
It can become active in the body system.
Before it can protect you or whatever.
Okay, so talking about PrEP, let's talk about the cure. Firstly, does it have a cure? Is HIV curable?
Okay, I don't think there is a cure for HIV.
Okay.
As at now. Yeah, but they can actually manage HIV. HIV, you said something, whether HIV is a death sentence.
Yes.
It is not a death sentence, and it is a death sentence. Yeah, because there are medications now. Gone are the days when once you are infected with HIV, your own don't finish. We are in the 21st century now. There are medications when you take. When you are consistent with your medication, you live a normal life more longer than people who do not have HIV. Yeah, so it is not a death sentence, but it can be a death sentence if you are not taking your medication rightly.
Okay.
And there is something I want to talk about. Sometimes there are people that are infected with HIV, taking their medication. Now they feel because they are positive and they are on medication, they feel they have the license to misbehave or maybe to have sex without protection. That is very bad. There is what we call reinfected HIV or resistant HIV. For example, God forbid, you are HIV positive, right? Both of us are HIV positive. And I feel maybe we are of the same status, so I can have sex with you. Now it could be that you have a resistant HIV due to low adherence to medication. Okay. Probably you're not taking your medications very well. You'll be infected with what we call resistant HIV. So if I come now and we have intercourse without protection, I would be reinfected with your strain of HIV. Yeah, with resistant HIV. Probably maybe when I take medication, it will not work.
Okay. So there are different types of HIV then?
Yes, yes.
Okay, so and then sexually transmitted diseases, obviously. So let's like someone said that there's something that even kills faster than HIV.
There are a lot of things that kills faster than HIV. I mean, if people actually know what HIV is all about, that's why I say the most important preventive measures is what's it called? Awareness. Yeah, if you actually know what HIV is all about, you will not be bothered, because there are a lot of things like hepatitis B and lots of them. What's it called? Diabetes, hepatitis A. You don't even need to have sex with anybody to have it. Just bodily contact. Heat. You can contract it, and it's deadlier than anything you could imagine.
Wow.
You understand? So that is just it.
I'm sure we've learned a lot in today's episode of Let's Talk Page. Okay, it's a very lengthy one, and because we are time conscious, I promise I'm going to bring Doctor. Oh, sorry, I keep calling him Doctor. I don't know, maybe because he's giving us a lot today about our health and all of that. And obviously, anybody that tells you about your health and what medication to take and what not to take is obviously a doctor, but he is not a doctor yet. Maybe he's planning to, but he is a health practitioner and a healthcare worker, also a health content creator. We will be bringing him back just in case you have more questions for him. Drop it in our comment section, or you can send us an email and then we'll get back to you, or he will talk about it when next he visits us in the studio. So guys, it's a wrap on today's episode of Let's Talk Rich. Okay, I hope we gained one or two of them, because I gained a lot on today's episode. Till I come your way next time, take care of yourselves and take care of others. Bye for now.